Ozempic and other GLP-1 drugs have taken over the conversation around weight loss. Nearly 1 in 9 adults in the United States has taken one of these medications at some point, whether for type 2 diabetes, weight loss, or both. That is a massive number, and where there are that many users, there are also that many problems to solve. And one problem is quietly getting more attention from doctors. When people lose weight on GLP-1 drugs like Ozempic or Wegovy, a significant portion of that weight loss can come from muscle, not just fat. According to Mayo Clinic's Dr. David Brennan, over 30% of the weight lost on these medications can come from lean muscle mass. 30%. Now, some muscle loss happens with any weight loss method. That part is not new, but what concerns researchers is what happens when patients stop treatment. Many people regain the weight, but they do not always regain the muscle, and that is where things get quietly dangerous. A study from the University of Virginia found that this muscle loss could seriously undermine long-term health. The researchers specifically flagged axial muscle, the kind that supports your posture and physical function. Losing that increases your risk of cardiovascular disease and drops your basal metabolic rate, which makes it even easier to regain weight in the future. It's a bit of a cruel cycle. So, the question is, can technology help break it? Samsung thinks it might be able to. The company has partnered with the Massachusetts General Hospital Diabetes Research Center to run a clinical study using the Galaxy Watch 8, and this is actually a pretty interesting setup. The study will recruit 100 adults who are just starting GLP-1 treatment and split them into 2 groups. One group gets the Galaxy Watch 8. They'll use its Bioelectrical Impedance Analysis feature, which tracks body composition directly from the wrist, alongside activity monitoring and personalized exercise guidance built into Samsung Health. The other group gets what most GLP-1 patients currently receive, which is standard guidance from their doctor. At the end, researchers will compare both groups using clinical-grade DXA scans to measure actual changes in body composition. If you're enjoying this breakdown, go ahead and hit that like button and subscribe. It genuinely helps more people find this content. The study will be led by Dr. Melissa Putman from the MGH Diabetes Research Center, and she put it well. She said the goal is to understand how continuous data from a wearable can give clinicians a more complete picture of how a patient is actually responding to treatment, so adjustments can be made faster and more accurately. Continuous data, not a snapshot every few months at a checkup, but real day-to-day information about what's happening inside your body. That's a meaningful shift in how we think about managing a drug's side effects. This is not Samsung's first time doing this kind of research either. Last year, they teamed up with Stanford to improve sleep apnea detection on the watch. They also worked with a hospital in Korea to develop the ability to predict fainting with high accuracy. There's a clear pattern here. Samsung is positioning the Galaxy Watch not just as a fitness tracker, but as a legitimate clinical tool. Whether this particular study delivers the results they're hoping for remains to be seen, but the approach is sound. GLP-1 drugs are not going away. If anything, their use is going to keep growing, and if wearables can help people preserve muscle mass while on these medications, that's a genuinely useful application of the technology, not just a marketing angle. The watch on your wrist might soon do more than count your steps. It might actually protect your health while your medication does its job.